Hi, everybody, and welcome to a video all about the topic we love to discuss, which is performance appraisals. Yes, in reality, actually, everybody dreads appraisals typically. The person doing the appraisal typically dreads them, as well as the person receiving them. And actually, a recent Gallup poll said that I think 14% of people only actually find appraisals motivational. I suspect from my experience that actually for dental practices, that number could be even lower. How then do we go about changing appraisals from being a real kind of just tick box exercise that we do for the regulator to make sure we're complying with necessary requirements to have done an appraisal? But how do we change that into making it an exercise that is part of a broader system of performance management that actually motivates people and is transformational in terms of driving the performance of your dental practice? So that's what this video is all about. I have 10 different ideas to get across to you, 10 different tips, let's say, for doing appraisals. The first 5 are more like concepts about doing appraisals and approaches and structure. And then the next 5 are specific kind of tips about what to actually say and do in appraisals. The first thing we really need to change then is actually our mindset and our approach to appraisals. Okay. My question to you is, what are we actually doing it for? So what are we doing appraisals for? This is the first thing we have to get into our mind. And that is actually to maintain and improve performance. This is the purpose of them. It's not just for satisfying the regulator. It's actually to improve and develop people and improve the performance of your dental practice. So it's not a tick box exercise. And yes, you may have to tick some boxes, but actually that's not what it's about. It's not about just getting it done. It's about how can we do it in a way that helps improve the performance of our people and then ultimately our dental practice. And so when you're spending time on it, it's valuable time because we want to improve the performance of our people and our dental practice. Right, so this is the first thing. But also there's only a small part of an overall system of managing performance and developing and improving performance, right? Just a small part of it. It's only a small part. It's part of a bigger overall culture that really we want to create of improving performance and creating a culture of feedback that will help improve that performance. So that's the first one, is mindset, making sure you have the right mindset and approach, which is that this is to help develop and improve performance of everybody in your practice and the overall performance of your dental practice. Point 1. Point 2 is around frequency. How often are you doing appraisals? Typically, people do appraisals once a year. Is once a year enough to be talking about performance with individuals? Absolutely not. I'm sure you'll agree. And this is what happens. We kind of go, well, it's performance appraisal. We'll do that once a year. Well, that's just no good. And everything you look at, everything that's out there around feedback and talking to people about performance is that you need to do this as soon after the event as possible. So waiting for a performance appraisal is useless, actually. So rather, in terms of frequency, we have to see it that all we're doing when we have an appraisal is we're summarizing all the feedback that we've given along the way. Now, that's difficult to do over 12 months. As I'll talk about later, we've often forgotten what actually happened 12 months ago. So what we have to do is take notes firstly, but also my recommendation in terms of frequency would be to have a more formalized conversation every 3 months that summarizes your other conversations over the last 3 months that you can probably remember and have hopefully noted down over those 3 months. So frequency, just doing this as a one-off every 12 months is no good. Okay. and we have to do it more regularly, but also on an ongoing giving feedback basis, but then also as a kind of summary, perhaps of those last 3 months. Yes, it takes time. It's very important because it's going to improve the performance of your dental practice, right? So every 3 months is what I'd recommend. So that's frequency, point 2, and how often we do appraisals. Then point 3 is who does them? I've seen all sorts of things going on in dental practice in terms of who does the actual appraisal. Sometimes, often actually, I've seen one person doing it for everybody. To me, this is madness. And is that person the best person who can see and view the work that's being done by everybody? Okay. The best person to do the appraisal is a person who sees and observes that person in action often and frequently. So they can give specific feedback about what they've observed, what they've noticed. It's not just, well, I'm not sure about this person. No, they have actually concrete examples. And this ideally should be the manager who can be there to observe and notice and see things. Right? Otherwise, we're reliant on feedback from other people, and that could be really biased feedback, as I'll talk about a bit later. So we want a person who's been able to actually observe and see that person in action doing their job, who is the person doing the appraisal. So point 3, think about who and make sure it's a person who can and is able to give first-hand feedback and observation to that person about how they're doing in their job. So number 3 is about who. Number 4, a big thing to really consider when we're doing appraisals is cognitive bias. Okay. Cognitive bias is essentially that we have these biases as humans that are well kind of documented, that we naturally have, and mean that we make decisions that are not rational and actually quite irrational. But they exist and they're quite well documented. And there's a few of them I'm going to talk through now. There are lots of them, but I think 3 I want to refer to that are particularly relevant for appraisals. First one is this: recency bias. And this is something that I alluded to earlier in terms of frequency, which makes frequency even more important. We remember what we've heard, seen, observed most recently. If you've had a nurse that's made a mistake with something clinically recently, or perhaps a receptionist booked somebody in with the wrong doctor or with the wrong clinician, wrong dentist, made a mistake in the last kind of week or two as you come up to the appraisal, this will massively influence how you appraise that person for the whole 12 months if you're doing it once every 12 months. It's what's top of your mind, and so that's what you'll come back to. When actually we need to appraise them properly over the whole 12-month period if we're doing it that way, and that's why it's better to do it every 3 months. It's just a bias that we have, so we have to be really aware we're not just judging them on something that's happened most recently, where actually we have to be looking at evidence across the entire period, right? So be very aware of recency bias and make sure you're not acting just on what you've seen most recently. Number 2 is confirmation bias. Confirmation bias means we see what we want to see. And to delve down further into that, it's halo or horn. You can probably think what that means, which is a halo effect. If you have a feeling or thoughts about this person, the halo being this person is wonderful and does everything perfectly, you will essentially delete out anything that they do that is not wonderful and perfect. And all you will see is all the wonderful stuff that they do. Likewise, if there's somebody you really don't like or just don't think is right, or for whatever reason, then you will actually only see the stuff that they do wrong and that you don't like, whereas all the great stuff they do, you won't see that. That is, again, bias to be really, this confirmation bias is really prevalent. So to be very, very aware is, and make sure you're looking out for the other side to individuals when you're looking at appraisals. And that again comes back to really looking at the evidence, looking for examples, real observations and evidence to help in that assessment. And then number 3, which is kind of related a little bit, I think, is groupthink. We fall in line with what the group thinks. And if the group has a view on a person that perhaps they're not a particular popular person, that can lead us to going, oh, maybe they're not very good, or we don't like them. And so therefore I'm going to kind of mark them down a little bit, because we're kind of falling in line with that, not liking that person, not really very popular, when actually it's totally irrelevant. It's about how well they are doing their job, right? And that's the most important. Now, there's an element of fitting into the team, but that's different. That's not the same. Okay. So we have to be really careful not to be influenced by group think. That's the third bias. And actually, taking a step back again and looking at the evidence of performance for that individual. So cognitive bias is really, really important to consider and to make sure that we are paying attention as to when those exist, and that we don't get sucked into actually living out those biases, but kind of interrupt them and look at the evidence. Two-way conversation. It has to be a two-way conversation, right? Ask the individual to reflect before, send them out any questions you want to ask them about their performance, get them to take some time to think about it before, ask questions, listen, give your perspective, and then engage in dialogue. But it's not just you telling them what's wrong. Make sure it's balanced as well. Give balanced feedback, but importantly, ask them for their balanced feedback. What are the things that really work well? What things haven't worked so well? It's a two-way conversation. It must be two-way, not just you giving or doing the appraisal. So two-way conversation. Now I'm going to get into kind of 5, I suppose, tips about actually the content and talking when you have the conversation. First one, which I've referred to already, is make sure you use evidence and examples when you're having conversations. Just talking about individuals and them without any evidence to back that up suggests that it's probably not very accurate, right? So you have to look for evidence and examples and ask the person for evidence and examples. This will help reduce some of the things we talked about before, such as bias. Don't make it all about the rating, point 2. It's not all about the rating, and there's different places will do that differently. Some still use a rating, some have stopped using ratings anymore, because it becomes an argument about what the rating is, and this can hack people off, cause demotivation, all these sorts of things, whereas we don't actually focus in on how are you going to improve performance and thinking about their performance and improving performance. So don't make it all about the rating. Put in values as the next point. Any of you who've watched or read any of my stuff, I'm a firm believer in the importance of values and how important they are for teams and dental practices. It's one thing to have values, it's another thing to actually live them. And you have to work really hard to actually make sure they're being lived and actually implemented into the structure of how you do things. And one of the ways of doing that is through appraisals or any form of evaluation, is to go and talk about, well, what examples can you give me of where you've lived the values? And what do you think, where do you think perhaps we've fallen short in terms of living the values of our practice? This means that it's a great way of reminding people about the values, and it also reinforces that they're important and they're going to form a part of how we look at performance. Next one, second to last, which is personal development plans. Within the appraisal, we have to make sure there's a personal development plan, which is about how the person can then actually move forward and improve. What are they going to focus on developing? Now, when I speak to people about personal development plans, a lot of times people think it's just about, well, what's my next job? And in a dental practice, there's not necessarily hundreds of opportunities to move into different opportunities, to move into different roles, although there's more than you might think. But the point is, that's not what personal development plans are about. Personal development plans are about, where can I focus to improve my performance? What skills do I need to develop, and what am I going to do to actually work on those? And that may include taking on specific responsibilities and actually doing them in reality, but it also may be just to read up about something, to gain more knowledge, and then to try and review and put things in place to then come back and see how we've developed in that specific area, to work with a coach perhaps to focus on a specific area and move that forward. So personal development plans is just not just about getting promoted or your next job. It's about how can you develop in what you're doing and as a person and in your skills and capabilities. Finally, then, this is number 10 overall in all these points, which is clarity of objectives. Making sure we're really clear on what our objectives are moving forward will help you then give a much clearer assessment when it comes to through the next period, whenever that might be, as to where you're heading. If the objectives are vague, it's very difficult to understand what performance has been against those objectives. So the whole SMART acronym is definitely relevant here. Specific, measurable, achievable, relevant, and time-bound. Time-bound is often the one that's missed. Often things aren't specific either. But all those pieces and making sure that's really, really clear, again, through dialogue, and that there's agreement, so that when you come back, you can come back to those things and there's no misunderstanding because it's really vague. So clarity of objectives is the 10th and final, I guess, tip in terms of doing appraisals. So that's a lot. And there's 10 different points there. To summarize, the first thing we have to do, and most important thing, is to really change our mindset in terms of appraisals, of being this tick box exercise. But actually, this is part of an overall way of managing and improving the performance of all our people within the practice. But it's only part of it, a small part, an important part, but it's only part of it. And actually, we have this broader context of how we go about, and system of how we go about improving the performance of our people and ultimately our practice. So if we change this mindset, then we can approach appraisals in a different way, structure them differently, and remember that they're part of an overall system of feedback that we want to give to this person and move them forward in their performance. So that's probably the most important thing. And then we can look at those different areas that I talked about, such as thinking about how often appraisals are done, who does them, and then what is covered in those appraisals and the specific little tips that I've given throughout this video. Thanks very much for watching. Good luck. And remember, this is all about improving and developing the performance of your individual people within the practice and ultimately the performance of your dental practice. Bye for now.